Good morning, everyone. Once again, welcome to Time of Your Life Celebration 2022, jointly organized by National Library Board and Singapore University of Social Sciences. My name is Paige, and it's my pleasure to be your MC for today's session. The title of today's webinar, Building a Community of Care, and you will find out more about the aid available to caregivers in Singapore. To ensure that everyone enjoys a seamless experience, the chat function, microphone, and video has been disabled. However, for the dialogue session, we do welcome questions, and you may click on the Q&A icon either at the top or at the bottom of your screen for the Q&A, and you may be able to post questions that you have, and also you may like the questions that interest you to upvote these questions. We will first begin our session with a sharing by Ms. Carol Yeung, Senior Assistant Director at Agency for Integrated Care Singapore, followed by a sharing from Ms. Gina, Social Worker at Montfort Care Singapore. We will then have a dialogue session with both Ms. Carol Yeung and Ms. Gina, which will be moderated by Ms. Anita Ho, Associate Faculty at Singapore University of Social Sciences. After which, we will have Jonathan, Associate Librarian from NLB, to share with us more about the NLB resources, and we will also be sharing with you about SUSS Gerontology program. Caregiving can be challenging as caregivers often need to juggle multiple roles and duties. Knowing where to locate and how to discern useful information on the internet can be significantly reducing caregiver stress. So we do hope that today, this online webinar will help us celebrate time of your life by diving into facets of aging like gerontology and caregiving, as well as physical and mental well-being. All right, so without further ado, let's kickstart the first sharing session. Our first presentation today, we are pleased to have with us Ms. Carol Yeung. Carol joined the Agency for Integrated Care, AIC, in the Caregiving and Community Mental Health Division in April 2019. She leads the caregiving team in review of the caregiving support strategy, develops caregiving resources, and increase awareness for caregivers looking for information. Hi, Carol. Good morning.
Good morning.
That's great. I can hear you loud and clear. So without further ado, I'll hand over the time to you.
Sure.
Thank you.
Let me share screen. Okay, thank you, everyone. Thank you for joining us this morning. So, I will not introduce myself again. I'm Carol from AIC. I am privileged today here to actually share with you a little bit more about what AIC can offer for the caregiver in the community. Okay, so let's start my sharing. So I guess in our life, we'll definitely cross paths with the caregiver. Some of us would have been a caregiver. Some of us currently are a caregiver. And some of us actually in the future, we will be a caregiver. But one thing we do take note is that actually towards the end of our life, all of us will need a caregiver. So as such, basically all of us in the time, we will be a caregiver. And we also noted that caregiver basically have to juggle many responsibilities. A lot of time, the caregiver have to look after their seniors, their parents, they have their children to look after. They also have their work commitment and also their bills to pay. As a result, a lot of time, the caregiver, their own health may be affected. Therefore, it's important here for us to let caregiver know what are the services, what are the support, and the resources in the community actually to help you along the way. To address the needs of the caregiver, actually back in 2019, MOH, together with some of the partner agencies, actually developed this caregiver support action plan to strengthen the caregiver support. And there are 5 focus areas that in this slide that are being developed. So they are like care navigation, financial support, caregiver empowerment training, caregiver respite services, and workplace support. So what we hope to achieve is actually to engage, to empower, and also to enable our caregiver through the different works under these 5 focus areas. In the coming session, what I'm going to share with you is that some of the community services available to help to support your loved one in the community. So in general, there are 3 main types of services. One is we call it care at home. So also in a way, we call it home care. These are the services that can be provided at the convenience of your senior's home. So that it could be like home medical, home social, home personal care services. Second, we call that care and center, which in a way we also call it daycare or center-based services. So these are the services the senior can go during the day and they can return home to the family in the evening. So these are, for example, some senior daycare or some day rehab centers as well. Last, we also have this stay-in care. Stay-in care are for those who basically cannot care for themselves at home alone, or with their family, or that they need care that they are unable to be provided at home. So then you have example like in the community hospitals or in a nursing home. And then I think one of the questions definitely will be asked is that, then how can I apply for such services? So basically you can get a referral from the hospital or the polyclinic that your senior or the loved one actually visit. Or another way is that you can visit our AIC link office. Our AIC link office are actually located at most of our restructured hospitals that you can actually visit them and then speak to them for what are the referral need in order to refer to loved one to the services. And in this section, I want to introduce some of the financial scheme that can actually help you to defray some of your caregiving costs. I'm introducing 3 caregiver-related financial schemes over here. The first, the caregiver training grant, is a 200 annual subsidies that actually allows you to actually attend the approved courses so that you will equip yourself with some skill to better look for your loved one. The middle one, we call it the home caregiving grant, is also a $200 annual, a 200 monthly cash payout. It's a mean tested grant that you can use this grant to actually offset some of your caregiving expenses. But there will be a requirement that your care recipients need to be with permanent moderate disability to qualify for this home caregiving grant. And on the right, you have this Senior Mobility and Enabling Fund. These subsidies provide for when you purchase, for example, like devices like commode or wheelchair or any home healthcare items. This is also subject to assessment by the qualified assessor as well. So aside from these 3 financial schemes that I have mentioned, there are actually other financial assistance available as well. And I wanted to highlight to you there is this brochure available that in 4 different languages that will highlight and share with you what are all different kinds of financial services that you can potentially tap on to support to defray some of your financial costs. Okay, now I want to touch on a bit about training and also resources that you could actually empower yourself in the caregiver journey. Okay, I think I'm going to repeat myself again. I guess a lot of us may neglect the importance of actually training. So I'm going to repeat myself again. There is this $200 caregiver training grant that you can tap on yearly. What I wanted to share a little bit more is that actually in our AIC website, you can click under the caregiver training courses e-calendar. You will have a full list of about 200 plus caregiver training courses that you can choose from. So basically you can choose the topics, the provider, or even the mode of training that most suitable for you. And not only you can use it for yourself, you can also actually apply this grant for the foreign domestic worker who are looking after your seniors at home as well. So do check it out for this caregiver training. Okay, next, I wanted to share with you on this Care Finder. So we do hear from a caregiver sometimes that information can be overwhelming. There are too many, I don't know how to navigate, I don't know how to choose what are the information relevant for you, for myself, for the caregiver. So therefore, we actually come up with this simple, we try to make it a bit simpler. We call that a Care Finder. It is also available in AIC website. So if you go under AIC website, you click under the Caregiving, and then you go to the what is caregiving, and you will see this, my Care Finder. So in summary, what it is through a self-assessed or maybe self-guided questions, you will be able to find some quick resources, okay, that link up to what you think you will need. So for example, we will ask a few questions about your care recipient medical conditions, what are the care needs that you will require, and then from there, you will actually give a quick link to what are the related information and the resources that you need. So that will, in a way, help you to navigate what are the caregiver resources that you need to look for. Okay, this is one of my favorite. Basically, what happened is that we do realize that in our senior, when they grow old at home, we want to make sure that the place are comfortable and safe for them. This is a collaboration piece of work that AIC have together with Dementia Singapore. Basically, we want to do is that we do a 360 virtual reality home in our HDB setting. How we will demonstrate to you what are the simple home modification or the tips that you require to make it safe for our loved one with dementia. But what I want to highlight here is that when I tried it on, I realized that it's not only applicable for persons with dementia, basically it's applicable for any seniors as well. So while I'm playing on it, I actually shared with my friends and family as well. It's really a fun app in a way that, but also you will learn what exactly you need to do in order to make your home safe. And this are some of our resources that we have created. So we have some top 5 caregiver resources for general caregiving, also some top 5 resources for dementia and mental health resources. So it would be good if you can just have a quick snapshot when you have time to read through what are the resources available to support you in your journey. Okay, next, what I want to share with you is that it's important on self-care, to care for yourself while you care for others. And while we are talking with the caregiver, a lot of them share with us that they find it beneficial if they join some of the caregiver support group, the support network, because through this network, they will find that they are not alone in the caregiver journey. They will have support through the other caregiver, and they also learn some very important skills along the way as well. So there are different caregiver support networks available. There are certain that are disease specific. There are some that are provided by some of our service provider in the community. There are different forms as well. So you can find some of the caregiver support network available in our AIC website as well. And another service that I wanted to share with you, this is one of our pilot program. We do noted that the caregiver who look after persons with dementia sometimes do feel quite a bit of a challenge, because at the night time, they may have some behavior issue, which we call that the sundowning syndrome. So for this pilot, what we do is that we partner with some nursing home, that the caregiver actually will be able to have some rest during the night by having their loved one to be in the nursing home during the night time, so that they could have some rest. And so this service basically will be, I think, from 8 or 9 p.m. at night to the next morning, 6 or 7 a.m. So during the night time, the caregiver will have some rest. And then your loved one in the nursing home will be engaged in some activity. When they're tired, they could rest as well. So this is a pilot that we are rolling out to target for the caregiver who are looking after the persons with dementia. And the self-care tips as well. I mean, once I have talked to a caregiver, and the caregiver actually emphasized many times to me that I think one of the message that we want to say is self-care is important. In fact, looking for self-care is not selfish. Important for you to look after yourself, so then you can actually better look after your loved one. There are some of the self-care tips that are available in our AIC website as well that we would like to share with you. I think later on, there will be some session that will share with you what are the activities that you can look after yourself as well. Okay, before I end my session, I would like to share one video with you. This is a caregiver that we have interviewed and that we make it into a short video. Okay. Okay, I will stop sharing.
I do not want to have that regret, feeling that I didn't do the best for her.
Hi, I am Azhar Abdul Rashid. I'm a primary school teacher. I'm a caregiver to my parents. Prior to joining the education sector, I was a paramedic specialist with Singapore Civil Defence Force for 5 years. I attended to patients with medical issues. So I guess that experience provided me an opportunity to understand the condition that my parents are going through and how to best manage my parents at home. In 2011, she went for her mini pilgrimage to the Holy Land, and over there she had a mild stroke which was undetected. So that's where she actually sought treatment in SGH. And that's where she was diagnosed with a condition called chorea, which affected her movement. So basically, she has involuntary movements to her upper limbs and her lower limbs. The doctor says that it's irreversible, and it will actually get worse as she moves on. My dad has a list of chronic ailments, and in January this year, he had a mild stroke as well, which affected his speech. The main role as a caregiver is making sure they don't fall sick, they are compliant to their medication, and they keep themselves active even though they have a medical condition. I was asking myself, why is it me? Why must it be my mom? Why must it be my family? But I guess that is something that I shouldn't be dwelling about. It is more about how do I move forward, manage the situation, and how best I can care for my mom. And what are the medical interventions or medical help that I can get for my mom. But at the back of my mind, I just want to make sure that she lives comfortably, she's able to enjoy the companion of my dad, and if one day if she passed on,
I do not want to have that regret, feeling that I didn't do the best for her.
For new caregivers, it may be difficult initially. I wouldn't say it's easy. It is tough, it is tiring, it is draining. Take some time, reflect, and think how best you can manage the situation. I am very, very lucky to have a very good friend. In fact, he's my best friend, who's always there to ask if I'm okay. I do have relatives who also ask once in a while to check out if I'm doing okay. Yeah. So I'm very fortunate to have great people around me. So no matter what situation you faced, look at it from a bigger perspective and manage one thing at a time. Go in small steps and identify what are the factors that can help you in managing the situation, and at the end of it, you know there is a success criteria to that situation. So in order for you to take care of your mental well-being, you've got to share. You are able to get a different perspective from different people. Because at the end of it, yes, you are managing it on your own, but at least you have different perspective, different views from different people.
Just this is my last slide, basically just say that if you want to reach out to AIC, what are the different ways? So one, that definitely you can go to our website. Another way is that you can call our helpline. And also do note that there is an AIC link that actually available in most of the restructured hospital that you can actually approach for support as well. So thank you.
Thank you, Ms. Carol, for your sharing. Isn't it a very real video that I believe most of our participants here can associate with as well. And I do see a lot of questions starting to come in. Do hold your questions, but also please feel free to type in the questions as Ms. Carol present and next presenter, Ms. Gina present. As they present, I'm sure you have some questions in your mind. Please feel free to type them in, and later on during the dialogue session, we will be trying our best to address your questions. Thank you so much for all the participants. All right, thank you, Ms. Carol, once again for your presentation. And right now, we will love to hear from Ms. Gina Pei, a social worker at Montfort Care. She supports the Case Management and Caregiver Community Lab project. Gina holds a Bachelor of Social Work from the Singapore University of Social Sciences. So right now, let us welcome Ms. Gina Pei right here. Hello, Ms. Gina.
Hello. Very good morning to everyone. Thank you for making time over a weekend to join this session. So actually, I'm a social worker from Montfort Care. So I think we heard from Carol from AIC about very useful caregiving resources and also information. So as the title of today's sharing, I do hope that we can make caregiving everyone's business and to work on a community of care. Yeah. So I will be, these are the areas that I'll be covering today. So I'll briefly share about my organization, how can we better identify caregivers, the community support for them, as well as some of the caregivers experiences and their voices that we have actually heard throughout my work in Montfort Care. So we are also very honored to actually have a caregiver today with us. So he will be sharing on his journey as a caregiver. And before I end off the presentation, I'll just briefly touch on some additional resources for caregivers as well. Yep, so actually an overview of our center. So we actually have 3 family service centers located at Marine Parade, Teluk Blangah, as well as Krita Ayer. So we also have our our child protection specialist center, also known as Big Love. And we have this Yeung at Heart program, which actually promotes positive aging, as well as the grief methods that we look into grief and loss issue. So for myself, I'm actually from Good Life, which I will cover it in the subsequent slides. Yep, so this is actually our vision and mission from Montfort Care. Yeah, and these are our 3 values that we work on for work towards in Montfort Care. So these are also values that we actually take on in our group work and the way that we actually work with our clients. Okay, so moving on to Good Life. So Good Life is actually the elder care arm of Montfort Care. So we actually work with all aspects of aging, from physical, mental wellness, end of life care, grief and bereavement support. So we mainly work with seniors 50 and above. Yep. So in our approach itself, we actually give like educational talk. We also have more of public awareness talk as well to increase public awareness of mental health issues and also many issues that seniors face. We also do conduct like functional screening. So we do identify like and address any senior related issues if needed. So in Good Life itself, we also work on like case management, counseling, and also support for caregivers and other individuals. Yep, so this is actually the model that Good Life hopes to actually work on. So I'll elaborate a bit more on my next slide. Yeah, so actually with this model, we actually use this to work with our seniors of different functioning level. So from the very active senior to the senior who are maybe experiencing end of life. So in Good Life itself, we actually have the Active Aging Center. We also have the CREST, which is also more towards like community outreach that focuses on raising public awareness, as well as the resources and also health issue. So Caregiver Community Lab itself is actually a project that I'm involved as well. So what we do in this project is actually we look into and also address some of these issues faced by caregiver. We try to uncover any barriers or any gaps within the care system that might actually stop like caregiver from reaching out for support. So we also have the Commit team, which is actually a holistic services for clients and caregiver with mental health needs, so that they can actually remain resilient in the community. So CCMS itself, we actually look into deliver holistic care needs, centering on the needs of our senior. So home personal care and home bathing are also to support the senior care in the community. So in our work, we actually look into 3 aspects. So one would be the community prevention. So earlier I mentioned like we do health screening, we do health talk, and also we do run programs as well. So we also have the social rehabilitation, which social workers or even caseworker, we do run therapeutic group works for our clients based on their strengths, based on their shared interests and their profile. So lastly, the person-centered care approach or intervention is actually what the social workers and workers in Montfort Care uphold. So we regard every individual as unique and deserving of understanding and respect. Yep, so actually before I move on to the next couple of slides, just wanted to get everyone to actually, if you can, to join us on this Mentimeter. Hold on, let me just stop share and share again. Can everyone see this slide? The QR code or the website?
Yes, I do.
Okay, so if I can invite you to take out your phone or even like any devices that you are using, you can scan the QR code on the right. or even type in the address, type in a URL and the code as well. So just wanted to hear from the audience, what do you think caregiver do? Okay, I think I will move to the next slide. Hold on. Oops. Okay, so I think I would want to hear from some of the participants here. Maybe you could type in like your responses, like when we talk about caregiver, what comes to your mind, or what do you think they do actually do for caregivers? Okay, thank you. We are getting some responses here as well. Oh, okay. Actually, the love, care, and support actually stood out the bigger word. Oh, actually, there's this word that stood out for me. I think I saw like pakao liao, which means like they take everything and anything. Okay, I think maybe just a couple of seconds. Okay, I think thank you so much for everyone who actually type in your input. So I think I would also move on to the next segment of my presentation. Okay, so I think everyone brought it pretty right. So this is actually what we are looking at when we talk about caregivers. So caregivers are people who provide care to an individual requiring support due to their age, disability, illnesses, or even special needs. So caregivers can be any individual who provide care to someone. So most typically in Singapore, what do we see will be mostly our family members. So or someone whom they have a personal relationship with. So it may be also very helpful if for us to understand if we are acting in a caregiver capacity or not. So there are basically several basic elements of care as presented in this slide that comprise caregiving. So it includes the first one would be financial support. So we do hear from caregivers, sometimes they do give monthly allowance, or they support the household expenditures, or they look into like paying for medical and health related needs. So we also have caregivers or clients who actually look into like keeping track of their loved one vital signs, noticing any changes in terms of their health, and also reporting to the doctor and nurses to have a holistic care for their loved one. They're also ensuring that their loved one is actually taking their medication and also going for their medical appointment. So when we talk about general care, I think this is the area whereby I think some of the individual might not actually identify themselves as a role of caregiver. So general care, we include assisting with errands, such as like picking up for prescription from the pharmacy, or even transporting, bring their loved one from medical appointment, or transporting from house to even going out for a meal, and also shopping for their daily needs and preparing for their meals, or even just helping out to run errands. So for social and emotional support, we do understand that there are also people who actually engage their loved one in social recreational activities. So they also attend to the feelings, the emotions of their loved one. And sometimes through caregiving, there are also some behavioral concern whereby caregivers have to actually attend to. So for helping with like physical and personal care, this may include like showering, grooming, toileting, or even engaging them in some exercises maybe the PT or OT have actually taught you in the hospital, and also helping to transfer them. So actually, if we are actually helping with some or most of these activities, chances that we are actually acting of a caregiver is pretty high. Okay, so for this slide itself, maybe I just wanted to cover on the different profile that you might be in. So if let's say you are a caregiver yourself, or you are a family member of a caregiver, we do encourage for you to help your family member or help yourself to actually accept the important role that you play in terms of supporting your loved one. So I think once you accept the role that you are actually a caregiver, it may actually help you to achieve a greater peace of mind and to take advantage of the much needed assistance out there. And there are also, like Carol mentioned, there are also many resources and services out there that's available for caregiver. So we also encourage for you to actually, if you are a caregiver, we encourage you to speak to your loved one, to your family, friends, or even any social service providers for assistance if you see the need for, because I think it's very important for us to get relevant support. So if let's say you are a friend or a colleague who know of someone who is a caregiver, so you can actually check in on them regularly. So most importantly is to listen to them without any judgment. You can also try to offer to be there for them whenever they need, be it their emotional needs, social needs, or even a very practical support. Sometimes it could also be like just making some time to actually have a conversation with them or to help them with a task at work. So for employers, if you are actually if you do know that actually your employees or there are staff who are actually a caregiver, we would encourage for you to actually work towards creating an inclusive workplace. So we can start by creating a culture of awareness. So actually changing the workplace culture to be more responsive to caregivers, caregiving employees' needs. So what I meant by here is that because a lot of time, I think we might need also other colleagues to support the caregivers, whereby they might need to take certain annual leave, they might need to take urgent leave because of the caregiving duties. So I think for the organization to be well informed and more aware that what is caregiving and to better support their peers who are a caregiver. So we do hear from like caregivers as well who are working. So they do share that they really appreciate if let's say organization can actually offer like flexible work arrangement. So for instance, like having work from home options, or even like the flexible working hours as well. So because they shared that they had to really balance between like the caregiving and work responsibility, and very often, like I shared earlier, they have to take leave, and sometimes these leave are not unpredictable. It could be really attending to any emergency at home. Yeah. So as a service provider, I think what we hope for is to have better communication with caregiver. So from service provider to caregiver, as well as within the service providers ourselves from different agency. So what caregiver mentioned is that a lot of times they feel like there is a lack of communication between one agency to another agency, and they often find themselves having to repeat their information, and this can get rather tiring and stressful for them. So when we are also relaying our message or our information with caregivers, as a service provider, it would be good for you to make sure that the information is clear. So it is important how we relay the message, the tone, the choice of words as well, to be sensitive towards them. So for caregivers, and also to provide any immediate support if any caregivers approach us. So secondly, it would be really about the pacing, which I think the video that Carol showed earlier. So a lot of times, I think as a service provider, we tend to ask them like, so what is the future care plan for your loved one? So what is going to happen to your mom, to your dad? But a lot of time for caregiver, this question can be rather stressful. So they cannot really imagine, or they can't really plan ahead due to their loved one health condition. So what they would really appreciate is for care service provider to actually pace and journey with them. Sometimes it could also really be overwhelming, the questions that we pose to them. So it's also for us to be more aware of that. So I think when I spoke to the caregivers, they mentioned that they would prefer if, let's say, the staff to be present with them, to handhold them, to journal with them, taking one step at a time. And if you are a member of public, so we do appreciate if you could actually reach out to any caregivers or any individual that you think they might be a caregiver to assist them in terms of navigating the services and resources. So you can actually even share with them like AIC website, or how do they even go about to get assistance. Yeah, so this slide actually is also what I curated based on my experience and my sessions with caregivers. So sometimes we may not know like what to say to caregivers, and often caregivers shared with me that they often feel misunderstood or struggle to manage expectation from others because of what they say. So the first point we talk about like we hope that we try not to say like, oh, I could never do what you do. So it's actually very hard to know that it can be actually true, and most people become caregiver at some point in their life, and it can be very sudden or it can be a gradual process. So when you go into a caregiving role or even responsibility, sometimes it's never it's whereby you never actually expected. So I think what we can say to them is that I know that I'm not there yet, but I expect to be a caregiver at some point of time. So this phrase actually acknowledges that the hard work of caregiving and show respect to them. And also it extends an invitation for caregiver to actually share their experiences, because you are admitting that caregiving is actually an unfamiliar experience for you, and one will be most likely to be a caregiver part of your life. So the second point, I think a lot of time we do hope that caregivers can go out there to meet us, to actually relax themselves, unwind. But for caregivers itself, posting such statement can actually be really painful and really very hurtful for them. So many caregivers, they themselves really want to go out to meet their friends, but they can't. So they can't because they have very limited time and energy. So probably like most of the time and energy are spent on caring for their loved one. And when they really have that pocket of time, they really don't have the energy to go out to socialize or go out to meet their friends. So statement like that also could also implies that caregiver can actually get out, but it's not a priority. So what we can say alternatively is that we miss you and know how difficult it is for you to meet us. So how about we plan a gathering at your place? So now that you have actually verbalized a recognition of the problem and offer to actually solve it. So if the caregiver decline, we should also be graciously like accepting it and let them know that this offer stands anytime. Or we can even suggest like alternative to meet the caregiver. So it could be a phone call or even like a Zoom video chat that you can allow to stay connected with. I think the third one is also sometimes what service provider would actually say to caregivers unknowingly, because I think we do see that it's very challenging for them to manage their loved one at home. So sometimes we come into solution, we kind of focus on solution. So like, oh, why not you put your loved one in a nursing home? But actually, this is a well-meaning phrase, but a lot of time, I think even if we ask ourselves, is there something we want for ourselves? And not many people would want to send their loved one to a nursing home or can even afford a nursing home. So nursing home itself, there's also like the bed crunch. We do know that there's a long waiting list as well. So even if someone is in a nursing home, I have caregivers who actually have their loved one in nursing home, but their caregiving duties doesn't stop. So they have to constantly like monitor to manage the care and to communicate with the nursing home care staff. So alternatively, what we can actually share to them is actually to acknowledge and to share that it can be really overwhelming, and for them to, the choice is actually up to them. Yeah. So actually, throughout my work in Good Life, I'm also very honored and glad that I have the opportunity to really interact and to hear from many caregivers, their experiences through focus group, through interviews, through surveys, as well as some of the sessions that I have with them as well. So in the next couple of slides, I'm going to talk about their experiences. So first of all, there are actually positive experiences that caregivers reported. So the first point would be talking about they realize that there's a better need to the importance to take good care of their health. So they are also worried they themselves become a care recipient one day and do not want their family members to be taking over the role or taking on the similar role as they are taking on right now. So looking at their loved one health deterioration, sometimes they also feel the fear of being unwell. They also focus more on their physical and mental health. So some caregivers, they also see it as a motivational factor for them to remain healthy so that they can continue to care for their loved one. So moving on to the second positive experience, they also talk about like improved relationship with their loved one. So because they have more time with their loved one, they get to better understand their loved one. There's also closer bond and also more social interaction with them. So they also reported that actually they have more intimate and more fulfilling relationship with their loved one, as maybe before caregiving duty kicks in, they were very preoccupied with work, very preoccupied with their studies, so they don't get to spend as much time as they would want to. And also some mentioned that because of the caregiving responsibility or the role, they actually shared that their relationship even with other family members have improved because there's more communication. They get to spend more time together as a family. So actually, even some of them, I have caregivers who come and share with me that actually they do notice that there's an increase in terms of their ability to interact with other older person, and some of them even choose to volunteer with us. So another positive caregiving experience is the personal growth. So this is actually the most gain that we actually have find out. So it actually compromised like being more patient, being more understanding towards their loved one. They also become stronger and more resilient. They have increase of self-awareness and they become more knowledgeable in terms of like navigating through services or even healthcare knowledge. So caregiver also spoke about like their own personal growth in terms of compassion, empathy, as well as understanding. So definitely with caregiving, it's never an easy journey. So we do hear that there are also some caregivers who shared that their experiences are not so pleasant. So the first of all would be they are not very sure like the resources and support out there. So the focus tends to be caregiver shared that previously before caregiving become an issue or become a talking point. Many times the focus tends to be on the patient or their loved one. So they are not very aware what are the services out there that can actually provide any form of support for them. So I think one of the suggestions that we have is maybe like the assistance and resources for caregivers can be made more visible in the community. For instance, like I do know that hospital, we are actually advocating for that, but I'm also wondering like for GPs and polyclinic, that would be also the other institutions whereby caregiver bring their loved one quite frequently as well. So the second point, we're also looking at the perceived lack of need. So in our work, when we ask someone, are you a caregiver? Sometimes we get the responses like, no, I'm not a caregiver. This is just something that I do. They have never seen themselves in this role because it's something that they do it very naturally. So therefore, like being a caregiver is not a label or a title that they bestow upon themselves. So they don't self-identify, they don't self-describe themselves as a caregiver. So they see it more towards a very family responsibility expectation kind of role. So like a role as a daughter, role as a son, as a role of a spouse, or even like a family member. And because of this, many of times caregivers do not reach out to services of support, like when we name it like caregiver support or caregiver respite, they might not feel that this is something for them. So actually what we are concerned is also because for caregivers, if they do not self-identify or if they do not recognize that this is their role, they might not reach out for support as well. So services, the third point we are looking at is also like services availability and affordability. So because many caregivers, they actually struggle with the loss of income as they have to leave their job due to caregiving duties, or even they get a pay cut, so they have to stop like working for fewer hours because they opt for like a more flexible work arrangement. So this big drop in income is not only just a financial headache for caregivers, but sometimes services also have a long waiting time or not enough manpower. So caregivers also struggle to get relevant support as well. Okay, so these are the three very unique caregivers that we actually spoke to. So just wanted to surface some of these experiences that they shared with me. So first of all is the caregiver who are not very aware. So they kind of figure out everything by themselves. There's this lack of informal and formal support. So they find that navigating through like services or the system can be really challenging. So especially so for those that are not very communicative, not very expressive, or they are not very tech savvy. So sometimes service provider, when they call up service provider, they may actually ask like, so what do you need or what do you want from us? But caregivers, when they call in, they feel very helpless, not knowing what they feel, what they need, or as they are not aware of what is out there. So this question itself might be something that caregiver might not be able to answer. Yep. Then we also have a caregiver. We have caregivers who are actually they want to be an advocate for like caregivers, other caregivers as well. They want to share their personal experience with like the community agency, with the financial hardship, and also this group of caregivers, they are the one who know that what are the issues and challenges out there, and they this group are very unique positioned to act as advocates. So we also have caregivers whereby they are really very well informed, well aware of services, and they want to actually appreciate having someone to kind of like journey with him, to actually help him in terms of like sharing with him what kind of resources are out there. So this is also something that we do hear from many caregivers who actually also we actually spoke to as well. So we actually come up with this caregiver hotline. So what we do is that a lot of times, I think as I shared earlier, or as Mr. Chin mentioned earlier, a lot of time caregivers, they themselves are not really aware what are the resources out there, or they kind of self-filter because of their own socio-economic status, or because of their own belief that they are not a caregiver. So the purpose of this hotline itself, we really hope that we can actually hold space to actually provide listening ear to caregiver. A lot of time, I think caregivers, they do need more advices. They do not need more suggestions. They really just need someone out there to really just hear them out, to actually give them the space to actually talk about their emotions, their caregiving struggles as well. So this is one of our intention for this caregiver hotline. Otherwise, we also we have caregivers who actually also contact us for like service navigation. So they are not very sure, like let's say they are looking at interim nursing home, because their helper might be actually going away for a long leave, or there's a sudden change in terms of like their loved one condition that they need additional support. So for this hotline itself, it's actually meant by myself and a few other colleagues who are social workers as well. So what we do is that we actually help to actually identify what the caregiver might be needing. So we will also be sharing some of the resources with them over the phone call. So because I think sometimes caregivers, they themselves find that they don't need like they don't need to come down for a counseling or a session with us. They just need to verify or to gain some clarity in terms of services. That's where this caregiver hotline come about. Okay, so we also have the flyer in Mandarin as well. So currently we are operating 9 to 5, Monday to Friday. So if let's say we do see more call volumes coming in on weekend, we might revisit the operation hours. But for now, I think we will be looking at 9 to 6, Monday to Friday. Yep. Then we also have caregivers who brought up that a lot of time they want to remain unnamed. They don't want to reveal their identity as a caregiver because of other concern as well. So that's where we actually have this caregiver virtual space. Palette is actually a Palette platform. So we do encourage like for you to share this platform with caregivers or with friends or family members that you think that might be suitable. So in this caregiver virtual space, we hope that it's a safe space because no names will be there unless you don't mind to be identified. So we actually share about some caregiver resources, some mental health resources, some dementia related information, and caregivers, they themselves also share like words of affirmation, words of encouragement as well. So we do hope that it can help us to spread like this platform itself for caregivers. Yeah. So actually at the end of before I end off my sharing, I really want to express my gratitude towards all the caregivers, including Mr. Chin, for sharing their input with us. I think these are really very rich and important for service provider. I think for myself, I do learn a lot along the way as I work with other caregivers as well. So yep, that's all for me. Thank you so much.
Now it's time for us to answer your burning questions. There is a lot of questions coming in. And right now we will be moving on to the dialogue segment of your screen to ask questions. And also not forgetting the little thumbs up at the bottom of the questions. There's a thumbs up for you to upvote questions because there are so many questions. We would love to prioritize that questions that interest you. All right, so without further ado, I would like to hand the time over to Miss Anita.
Thank you, Paige. Yeah, thanks for the participants to type in your questions in the Q&A chat box. Yeah, as much as we want to answer all your questions, but because of the limited time we have, pardon us if we have missed out your questions. And also for the speakers today, feel free to also look into the Q&A chat box. If you think that any questions you would like to take it up and answer, feel free to do so. Yeah, perhaps let me start off by saying that like what Carol has mentioned, that all of us will be a caregiver one day, right? And some of us already a caregiver or were caregiver in the past. Caregiving is something that we are not trained for, and yet all of us will be a caregiver one day. So I would like to ask all of you, how can we better prepare someone to be a more effective caregiver, especially for a caregiver like Mr. Chin mentioned about he's being the only child in the family. Yeah, so he can dedicate a lot of time to care for his parents. Yeah, but as Singapore population's age, then in the end, who will care for the caregivers? I'm sure that there are some news and there's a lot of discussions also mentioned by the caregivers saying that for those who dedicate so much time, and some even shared that they have missed the opportunity to build up their own family because they dedicate all their time to be a full-time caregivers. So when they go old, actually, who will be able to care for them? Yeah. So for this topic, perhaps the speakers and Mr. Chin can help to express your opinion on this. Who would like to start first?
Hi, maybe I start first.
Okay, Carol.
Actually, to me, while I speak to some of the caregiver, I guess one of the challenge at this moment is that a lot of caregiver doesn't even realize that they are a caregiver, even though they are doing that role. Yep. Especially in the Asian context, they will feel that I am just a daughter, I'm a son, I'm just doing whatever I need to look after my dad or my mom. I guess what happened is that if you don't recognize yourself as this caregiving role, you may not actively go out to seek support or services or resources to help you. So I guess one of the important awareness is that for those who are sitting into this talk today, if you happen to see people around you that actually doing this caregiving role, I think you can actually kind of like share whatever message or you have learned today to them as well. I think what happened is a lot of time caregivers themselves are so engrossed with the duty that they may not have time to step out of this role to attend even this kind of talk or even like to get the resources. So I guess one good way is that through our own knowledge, we can share with our friends, our families, or whatever the people we encounter. Okay, this is my thoughts at this moment. Yeah.
Yeah, thanks, Carol, for sharing. Yeah, what about the two panelists? Yeah, like Gina, when you work with caregiver, yeah, I'm sure that quite a number of them also sharing the same concern.
Yep, I think if let's say sharing from like the service provider point of view, I think like what Carol have brought it up, and also in my presentation we talk about the lack of self-identification. So I think bring the awareness of like what entails like a caregiver, what is the role of a caregiver, which is why I actually had that in the Mentimeter. So just wanted to increase everyone awareness of actually a lot of things that we do, like even helping out with like paying bills or bring our loved one to the hospital. These are actually acts of caregiving. But a lot of time, I think caregiver, they themselves don't see this as a role as a caregiver. So for service provider standpoint, I'm just wondering out loud, maybe sometimes when we prepare like or we come up with certain services, maybe it's good to actually include caregiver. So for the caregiver community lab itself, we actually co-create and pilot ideas together with caregivers, because a lot of times we might also have our own certain expectation or assumption on how they actually perceive certain message. So hearing from the caregivers and also including them in terms of co-creating, I think that would be something that would benefit them more.
Yeah. I have also seen more and more support services, for the seniors and caregivers being developed, throughout the last decade. Yeah. I think one of the needs that Mr. Chin and also many caregivers also have mentioned is access, to information, right? Yeah. So of course, Carol has mentioned about the AIC portal, which house all the necessary information for caregivers and families who would like to seek for support. Yeah. But again, we understand that not all caregivers are IT savvy. Yeah. So Carol, is there any other go-to point that families or caregivers can go to just to inquire about available services?
Yeah, I think thank you. I think that's a very good point. I guess I think most of the caregiver now, the younger one, they are tech savvy. Definitely, they can go into our AIC website to actually navigate and self help. But there will be a group that likely will need that face-to-face help. Therefore, I would actually need to actually emphasize that actually there's an AIC link office. We try to set up as much as we can at the restructured hospitals. So there is an office, I think, with quite a few of them. Okay, I think there's one in Maxwell in AIC office. There's one in Changi Hospital, one in Khoo Teck Puat Hospital, NUH, Teng Phong, Outram Community Hospital, Sengkang Community Hospital, and SGH. So all these AIC, all these AIC link office will have our staff there to actually help to help you to answer your question and navigate the scenes as well. Because to be honest, sometimes even though I know that a lot of caregivers actually are very tech savvy that they can maneuver, but there are still things that they will find it a bit hard to actually figure out their way. So yeah, feel free to go to our AIC link office to actually seek help.
Thanks, Carol, for the information. That's very helpful. Yeah, of course, a lot of elder care facilities, they can also provide information and referral services. Yeah, so if you're not sure where you can get help, just pop by, and give a call. Yeah. And other needs, of caregivers that I have heard, based on what have been shared, is self-care. The importance of self-care. This is a big topic, when we help caregivers to manage their stress. Yeah. But many times caregivers find it difficult to find time to self-care, not because they don't know how to self-care, it's how to find time to self-care, because they feel guilty. Yeah. If they have to leave the house or have to leave the caregiving task to someone else, and they term it as, I go out and enjoy myself. So, I think that, there's also one question, how to draw a line. How do I know that, I'm taking time for myself and yet I will not be seen as being selfish? Yeah. So in this topic, perhaps, Mr. Chin and Gina, can help to answer.
Okay, so about the self-care, sorry, can you repeat the last part of your question? Sorry, because I was answering the other question on the chat box.
Oh, okay, yeah. How we can help caregivers, to understand how to draw a fine line, because taking time to self-care but not being seen as selfish. Because some of the time, they find it difficult to take time off, right, from caregiving, because on one hand they feel guilty, on the other hand they also afraid that they will be seen as selfish.
Yep. Okay, so sometimes if let's say like the caregiver at our end, if let's say we do see that they're actually getting overwhelming, like I think guilt, or even like they have certain very strong emotions. So sometimes we do have separate sessions just to actually process with them on this part of their emotional aspect. So I do understand that caregiving sometimes is we talk about like the physical demanding, but there's a lot of times there's a lot of emotional expectation as well. So sometimes if possible, we do also encourage them to talk to their loved one, their family members. Otherwise, we do sometimes have a family session together with their loved one as well, because a lot of times the expectation from their loved one can actually be an additional stressor. So like caregivers who share with us is that a lot of times they get expectations from their other siblings, other family members that, oh, why did you not do this, or you should have done this, etc. So sometimes we would also have sessions together with the other family members, or if possible, we can also reach out to them if caregivers allow us to do that. So we can also help them to see from the caregiver point of view, what is the whole challenge about, or what is the whole caregiving situation is like.
Yeah. So I have come across a lot of caregivers, just like Mr. Chin, the focus is always, on the loved one, and they never thought of, taking time off to care about themselves, to the extent that, there are caregivers, who have missed out, their own medical appointment because, they are so engrossed and they dedicate all their times to care for others, but not caring for themselves. But bear in mind that caring for yourself, taking some time off, to relax, or even to get some support, for yourself is very important. So some of the questions posed by the participants, also talk about like, they encounter maybe some of the caregiving challenges with family members.
Caregiver support network as well, which I think Montfort do have quite a few. Dementia Singapore, they do have a few. And I think within AIC, they have this effort called the Caregiver Support Network. Basically, as a different area that they want to gather the different caregiver together. So it could be a caregiver who looking after any conditions, okay, that they feel stressed, that they can reach out to. I think there are many different platforms, and in fact, lately I speak to, for example, like Cancer Association or even like Stroke Association. They also mentioned that they do have support group for their care recipient and caregiver as well. So in fact, there are many different ways. There are, I think, a list in our AIC website as well. So if I manage to find it now, maybe I can post it in the chat as well.
Okay. Yeah, thank you, Carol. Maybe to add on, I think there's also a question asking about like social media platform. So besides, I do know that as we take on like the role of caregiver, we do see like younger caregivers as well. They are more well-versed in technology. So actually there are Telegram groups, there are also Facebook page that are actually shared in the, I think, Q&A as well. So I think these are also excellent platform, because a lot of times I think there are also caregivers there to actually reply to other caregivers' inquiry. And I think it's a first-hand experience that actually I think caregivers find it more helpful as sometimes hearing from professionals.
Yeah. Yeah. So some people also ask about where they can find personalized guidance. Yeah, I think, the guidance is, on maybe where to get services or where to get help. Yeah. So I think Ms. Carol has mentioned about this iCare link here at various hospitals and also many touch point like those elder care facilities, which can approach them for more information. Yeah, but of course, there are also a case management team in the community which can help to link up services, and also they help to manage, some of the complex needs, of the families, that they require. Okay. Perhaps, let me ask these questions, even though it's not, posted, by the participants. Yeah. When we read news here and there, sometimes we have seen news regarding suspected elder care abuse due to caregiver stress. Yeah. So at times, caregivers, because they do not know how to get help, and they also maybe they did not get help. Yeah, and they're trying to manage, as much, as they can, to the extent that, they could not anymore. Yeah. So if we have such cases, then, what are the available services that, can help caregivers to better manage, their stress? Yeah.
I can take over this question first. So besides like service linkages, we do have like sessions, like counseling sessions with caregivers as well. So we do sometimes through the caregiver hotline, when caregivers call in, if let's say it's just for service navigation or for service support, we will keep it as like an intake level, so we wouldn't follow up thereafter. But if let's say we do hear from like caregivers that you mentioned, we do understand that sometimes I spoke to a caregiver recently. She mentioned that sometimes it's not so much about like me losing control, but it's a lot of times that they are being like the word that she uses, being stuck in a place with their loved one, and can really get very tiring. I think some of them pointed out that it's 24/7 duty. So we would actually encourage them to actually like we will reach out to them. So if they are open, we can also do counseling with them to actually provide the emotional support. And also a lot of times I think we do explore options as well with them if they're comfortable in terms of like interim respite. So recently, one of the caregiver that I spoke to, she actually took on that. So she started having that extra time for herself as well. So in Good Life on Montfort Care itself, we do have caregivers who are actually going through huge stress, and they would also be following up in terms of for themselves. So like Mr. Shin mentioned, a lot of times I think caregivers, they don't see they themselves having something to attend to. They always find that maybe it could be my loved one, that they need more medical support or may need more services and assistance. So if we do through our conversation with the caregivers, if we do notice that they might need some support, we will also explore the possibility with them.
Maybe to add on as well, actually in AIC, we do have this team called the CREST CG team. In summary, it's called a caregiver community outreach team. Basically is to reach out for caregivers who are having basically a lot of stress looking after their loved one. So the services actually include some stress management, future planning, some self-care talks, or maybe self-care activities, counseling services, and definitely linkages to support group as well. So if the individual or caregiver actually would like to know more about this CREST CG program, they can definitely contact AIC. Currently, we have 3 service providers providing this service. One is CAL, our Caregiver Alliances, Dementia Singapore, and also Clark Hill.
Thank you so much. Yeah, these are all very valuable support services, for caregivers to cultivate relationship with your friends and families, because they will be your pillar of support. Yeah. Okay. Perhaps Carol and Gina, you have any other questions you want to take up from the Q&A chat box?
Yeah, I think I pick up one question saying that they have a friend that's staying in Sembawang and have dementia and other medical conditions. So where can he actually get help? Just like to share that actually for dementia, there are quite a different kind of service available for support right now. Depends on the condition and the stage of the care of the dementia. So what I would suggest is that if your friend actually have an upcoming appointment in any hospitals or polyclinics for the dementia condition, do reach out to the staff to share with them the needs. Because what happened is that there could be dementia daycare that's available. Lately, actually, there is this post-diagnostic support for caregiver for dementia patients as well. So I think all this might be useful. But then definitely if you speak to your healthcare providers in the hospitals or in the polyclinic, they will know the conditions better. They can make the referrals accordingly. Or otherwise, same thing that I want to emphasize is then you can actually walk into the AIC link to ask more regarding the dementia services in the community. Yeah. Thank you.
There's a question that asks about so how can friends and families of caregivers pick up signs that caregiver might need support, because in Asian context, I think it's quite pricey to actually ask for support. So I think this issue is very real. So I think as Mr. Chin mentioned as well, so sometimes it's about as a friend and family members, sometimes you could really just do check in with them. So I think I hear from caregivers, sometimes what do they do is they will just pass maybe a flyer that they see that might be relevant or might be helpful for the caregiver. So I think it's very important for us as a friend or family members to be very mindful of our pace as well with them. So sometimes caregiver might not see that they are ready yet. So for instance, I actually received a caregiver call from the hotline after she actually received the flyer for about 8 months ago. So she only started to call 8 months later, because that was where she realized that she's ready to get any support or assistance. So I think a lot of times it's for us to pace with them, to do a regular check-in with them, and to just gently let them know that there is services and support out there. So when they feel that they have hit the limit, or when they feel that there's really the need to actually seek for support, they know that where are some of the support available out there. Thank you.
Thank you so much, for Gina and Carol's reply on some of these questions. Is there any other questions in the Q&A chat box? We can take it up. I think there's one talks about how to also resolve conflicts between family members. So I suppose that in caregiving journey, sometimes there may be disagreement between family members on the appropriate care arrangement, or how things should be done. So in that case, when they face difficulties, what would be some of the tips would be useful for caregivers, or any other support services can help them try to still keep in contact, even though sometimes the conversations, the things that they discuss might get really difficult. But I think what would be helpful also for family members to actually identify a main spokesperson or a decision maker. So that would be the person who actually will be advocating for, or the one who actually concludes. So okay, we are hearing from different viewpoints, different opinions. So for this particular person to actually take on the decision-making role. But a lot of times, I think for family members to also invite, let's say sometimes if needed, social workers, or I think ourselves also get involved, because I think sometimes it would be more helpful to get a third party to actually be a bit more objective, because sometimes when family comes to talk about, there could be also some personal feelings that come about as well. So I think sometimes as a role of social worker, we help to facilitate such conversation for family members as well, so they can stay objective and look into the care needs for their loved one. Yeah, thank you.
Yeah, I think Gina and Shin have shared the most valuable input and insights already. So maybe I'll just add on a little bit. Yeah, indeed, like what Gina said, if you need to actually step up to actually get some professional support, actually there's FSCs around, the family centers that actually can provide such counselings as well. Yeah, thank you.
Thanks, Carol. Yeah, and of course, there are training courses available for caregivers to take it up. Yeah, perhaps, Carol, you also can let us know, besides those training on caregiving, how to manage, caregiving tasks, are there any psychosocial topics that related to manage stress, manage, let's say family conflicts, that kind?
Okay. Actually, under the CTG training grant, there are quite a range of different courses available. But I do admit that currently most of the courses are actually dealing with the ADL need, transfer, safety, or a little bit more advanced into nursing care, dementia care. But there are actually courses that are on self-care and a bit of the social psycho support as well. In fact, I think we can look beyond this CTG. There are other places actually, some service providers do conduct, courses or even seminar or even talks about communications. Yeah, so they are available in the community.
Yeah, thank you so much. So, caregivers, do look out for those seminars, talks, for self-care, for caregivers. And of course, there are professional service, that can help, in these areas. Yeah. Perhaps any any other further questions, in the chat box so that, we would like to address? Or is there any other informations, or comments, you all would like to share? Yeah, based on what we have heard, from the other panelists who has shared.
Maybe I just share one of the question that being raised, and I totally agree with them. I think there's a comment saying that the caregiver are not only those caring for the seniors' parents, but also those with special need children, adult children, and even sibling. Comment, please. Totally agree. Yes. Caregiver actually span quite a wide range, but I think today, because of the context of the organization that being involved, and tend to be a little bit more towards caregiver for seniors. But totally agree with you and align with you as well. Those actually looking after special need children, all these are caregiver that we need to look out in around us to provide the support, and they equally important to look after themselves. Self-care is definitely important. In fact, I just shared that in fact we have an agency called SG Enable that they are set up to look after the disability group in Singapore, including the caregiver as well. Yeah.
Yeah, definitely. Yeah, I always seen my mom as a serial caregiver. Yeah, because when I was young, she was taking care of my great grandmother, then my then my grandparents. Yeah, then subsequently, when my father medical condition deteriorate, then my mom was a caregiver, to my father. Yeah, and now my mom alone because my father passed away. Yeah, and she helped my cousins taking care of her firstborn child. So my mom's caregiving journey has never ended. Yeah. So to some, it's a long journey, and but not all the time, it's stressful and all negative. Yeah. And I mentioned that, I think I've heard, Gina mention some caregivers also talk about some positive impact, right? Yeah, some positive aspect of caregiving. Yeah. So those things will really help caregivers to keep them going on. Is it Mr. Chin? Yeah, do you agree with that? And also all the available services and support for caregivers. I hand over the time to Paige. Thank you.
Thank you so much to all our panelists as well as moderator. Miss Anita is indeed really insightful, a lot of sharing, and this is also where we mentioned we are one community, we are here for you, and yeah, this webinar is also one of the resources that we have for caregivers. Thank you so much for all your sharing. Really appreciate that as well. It's really, really engaging and insightful. Okay, and right now, next up, it will be from the NLB Associate Librarian, Jonathan Poe. He is going to share with us more on the NLB resources. Hi, can we have Jonathan up on screen?
Hi, a very good morning to everyone. As Paige mentioned, I'm Jonathan. I'm an associate librarian with the senior services team at NLB. And I will be taking you through some resources that we've put together for the Time of Your Life celebration this year. Next slide, please. Right, to show you how to access these resources on your own, we have actually created a one-stop resource page where you can find all our resources in this link. So once you scan this QR code on the screen, or you use the link in the chat panel, you will actually see this web page that is the screenshot on the right of the slide. And this will take you to our different resources. Next. Right, so first up, I'd like to share some of the recommended reads that I've curated for today's session. So here are 3 books that may be useful for further reading if you want to learn more about the topic that was discussed today. The first one is titled The Wounded Healer, The Pain and Joy of Caregiving. So as I think the speakers have shared, and also participants in the chat, that caregiving is not just physically exhausting, but it's also very emotionally draining and may actually lead to burnout. So often caregivers believe that their feelings do not matter, that they should ignore their difficulties and they just suck it up. So obviously this is not true. And this book, through a mix of first-person stories and clinical case studies, it explores how, as caregivers, we can break free from this cycle of silent suffering so that your own well-being, as well as that of the ones that you are actually caring for, can continue to be uplifted together. And next, we have the unexpected journey of caregiving. New caregivers are usually plunged into unfamiliar duties, right? That they require knowledge and skills that they have not previously had to learn. And what this book discusses is actually caregiving, the process of caregiving as it unfolds in all its confusion and its messiness. And the author doesn't attempt to hide these, but instead embraces them to talk about both the privilege and the difficulties of caregiving. And it is this nuance and this genuineness that make this book a very good read. And finally, we have Caregiving for Dependent Older Persons. While this book also details the knowledge that a caregiver should have and also provides a step-by-step guide on the skills to have when helping older persons with their daily activities, I've actually included it here because it is written by two Singaporean authors for the Singaporean context. So, apart from gaining some broad knowledge on caregiving as a whole, what this book will be able to do is to be more relatable to us, and the specific details inside, I believe, will also be a lot more applicable for us. Next. So moving on, this resource page will also link you to Udemy Business, which is an online learning platform that is offered free of charge by NLB, where you can learn at your own pace. So you can find up to 13,000 courses, not just on business, but also personal development topics such as communication, mind mapping, and even things like how not to procrastinate. Really anything and everything you will need, you can probably find it on Udemy Business. And all you need is really a valid My Library username to get started with Udemy Business. So do explore it when you have the chance. Next. We have also put together a resource list on self-care. So we have touched on the physical, the mental, and emotional aspects. And this guide actually will, we hope that it will equip you with some skills to manage yourselves better when facing challenges in life. And this is especially important for those who are in a caregiving role, because I think it has been established from our speakers and the chat group that, caregiving is very overwhelming, especially if you're new to it. Next. Yep, so this is just to round off, this is a reminder again that you can use this QR code to find all our recommended resources through this link. And besides what I've gone through, this resource page actually also has links to other things like the NLB mobile app. And if you don't have NLB mobile app yet, I highly recommend it because it's a very handy app. It allows you to borrow library resources and allows you to keep tabs on your library accounts, such as your loans, all from the convenience of your mobile phone. You can also use this link to join our Time of Your Life mailing list, sign up for various events, as well as read the Time of Your Life magazine, which is actually a magazine that has articles that is written by our librarians. And finally, after attending this year's Time of Your Life celebration, if you are curious to know what we did in our past two editions, you can also check them out through this link. We have some videos that you can watch. And so that's all from me. Thank you. And I hope you have found this sharing useful. I will now pass the time back to Paige. Over to you.
Thank you very much, Jonathan. To our participants, we do hope that you have managed to screenshot and, recorded all this resources and information, because, you don't have to make yourself a trip to the library. You can have all these resources online with just a click. We do hope you managed to screenshot that. Okay. And also, after attending the talk about building a community of care, I'm sure you want to learn more about aging issues in Singapore. Singapore University of Social Sciences is the first university in Singapore to offer a holistic training in gerontology and topics aging studies. SUSS offers programs from minor in applied aging studies for undergraduates and professionals to graduate, certificate, diploma, master, and even PhD options as well. So students will learn about health and well-being, aging process, dementia, social policies in gerontology, technologies in aging, and more. So to better address the Singapore's aging issue, we need a multidisciplinary team to work together. So you can be one of them to join us to manage the aging challenges and promote healthy aging together. So if you're interested in SUSS gerontology programs, do take a screenshot or a snapshot of this current slide you can see in right here to learn more about the unique features of each program, as well as the next intake and application details. So do also follow SUSS Facebook to find out more about the program and opportunities in the aged care sector. So this will be the sharing from the SUSS. Please take a look. We hope you can manage to do a screenshot as well